in labor, and therefore she's likely to deliver even before her time is due. And of course, it's either she deliver a live baby or she may deliver even a stilled baby. So in that regard, I think if such event happen, it is important for the woman to go to hospital or the nearest clinic for an urgent attention. It is also obvious that when you lose the mother, the probability that you are going to lose the child is very, very high. The moment there is a condition that is likely to result to the death of the mother, what we call maternal death, there is also a very high probability that you are going to lose the baby. So if you are losing this woman at a time before she's at 7 weeks pregnant, of course, you are likely to lose that baby. And a lot of factors come into play here. And she has talked about illnesses in pregnancy, starting from high blood pressure, some high blood pressure associated with pregnancy. It's quite technical, but I think any woman who develops high blood pressure in pregnancy is a very big risk. Other risk, which sometimes commonly people who put it eclampsia or preeclampsia, the woman has the risk of delivering before. You can have women, like she said, fever, diabetes, a woman who is a sickle and require good attention, and many other illnesses in pregnancy can result to the woman having a premature delivery. We have, she has listed so many of the factors, which not one person should exhaust. But I think the partners should also contribute as to why should a woman have a premature child? And how do we prevent it? And what are the consequences? And how do we manage a premature baby? Then we get, at the end of, at certain level, we get the experience of our beautiful women who are here with surviving premature children. Thank you very much.
Well, thank you, Honorable Minister. So I think we will start off with Save the Children.
On behalf of Save the Children worldwide, we are really pleased to be part of this very important day. I think the slogan of World Prematurity Day sums it up. Every breath counts, and born too soon, hold them close. And I think this is really the message that we're wanting to put out throughout the world, that if we really take action now, I think not just in Nigeria but globally, we will save the lives of millions of children, and that's what we want to do. As Save the Children, we are committed to continue to support the people of Nigeria to save the lives of premature babies. And I think it's just wonderful that we have some of the mothers here, and also we have one of the young boys who has survived prematurity. And what is Save the Children doing? Well, we're working with the Ministry of Health to train health workers in Kangaroo mother care. And I don't know if many people know about Kangaroo mother care, but this is when you have a premature baby, and we say that you should skin to skin, so that you put the baby immediately to the skin of the mother, and we do all we can to keep the baby warm. The director has mentioned that it is very important that premature babies are kept warm. It's also important that we ensure that they receive the mother's breast milk, and that they are exclusively breastfed. How do we do this in countries where we have power shortages? How do we do this in countries where many women are giving birth alone? And this is why we feel that Kangaroo mother care, the skin-to-skin approach, it's very important that we go to scale, and that we support health workers to work with mothers who are giving birth to premature babies to understand what Kangaroo Mother Care is all about and what they should do to increase the chances of survival for the babies. Kangaroo Mother Care is an alternative to having incubators. Even if we had, if the power was there would still not be enough incubators to go around for the number of babies that are born in Nigeria, but also globally, before the 9 months. It is really important that we reach babies in every area of Nigeria, and that they do have access to this intervention. We have to get right down into the hard-to-reach communities. We need to promote that you don't need an incubator, that the baby should go on the chest, that we have to ensure that we have the hat on the baby's head so that they don't lose any heat, and also that they have some of the booties on their feet. These simple measures can help us to save lives. Save the Children, as I said before, we're helping to build the capacity of health workers to scale up Kangaroo Mother Care. And we want to make sure that in 2014 and beyond, that we will reach more children. No government and no agency can do this alone, and I think this is why it's very important that we have all the partners around the table so that we can work together and to ensure that we can replicate this model and go to scale and to reach all corners of Nigeria, but also globally. And that's why Save the Children globally, we, through our Saving Newborn Lives and our other work on the continuum of newborn care, that we're using or we're learning from the experience from other countries, but also sharing the experience from Nigeria and globally. So I just want to say that today and on Sunday, it's really important that Nigeria is seen as being in the forefront of saving the lives of premature babies and giving them the chance to survive. Nigeria is one of the powerhouses in Africa, and if we manage to stop the 84,000 babies who are dying annually because of prematurity, then we are going to achieve a lot, and I think we can do it in 2014. We can really make a difference. We commend the government of Nigeria, we commend our partners, and we commend all the frontline health workers who are playing an important role in the battle to prevent newborns from dying, and we will continue to support them. However, more needs to be done, and we would also like to ensure that the government also rolls out and scales up the distribution and access to the corticosteroids, which helps preterm babies to develop their lung capacity and helps to treat the infection. So again, on behalf of Save the Children, not just in Nigeria, but globally, we're very happy to be part of this important day. Thank you.
Yes. Before you transfer the mic to another speaker, because I'm expecting that we are speaking to the public. So I think, in Africa, you talked about Kangaroo Mother Care. In Africa, the common practice is to just throw the baby on the back and tie the baby at the back, and it's also skin to skin, isn't it?
Yes.
If the mother decides not to put a shirt on her, and then the baby is not having a shirt, only the common denominator there is what covers mother and baby. We carry our babies on our back. Now we are trying to introduce Kangaroo Mother Care. It's important for us to educate the audience as to the advantage of the Kangaroo Mother Care vis-a-vis where we carry babies on the back. And we find that some mothers, when they carry the baby on the back, they just carry the head, put under there, and even start feeding the baby. You understand? So I think it is important if you can expatiate more on that and maybe give the public what is the advantage of kangaroo mother care vis-a-vis carrying the baby on the back. I know, but for the sake of audience, I think we need to speak on that. Yes.
I will pass it to my colleague, Dr. Williams.
Yes, because she's an African.
Thank you very much, Honorable Minister. Kangaroo mother care, as the name implies, the animal called kangaroo gives birth to her baby when the baby is very, very young. And as such babies cannot survive outside of a kind of pouch that is in front of the animal. The baby crawls in there, and within the pouch also you have the teeth of the mother's breast. So the baby is able to breastfeed as and when due and grows up gradually. And by the time the baby matures, the baby crawls out immediately. We're asking, the world is asking, that because there has been scientific evidence around kangaroo mother care, we're saying mothers can do same. It is natural in Nigeria for mothers to put their babies at the back. But when your baby is at your back, can you see what is happening to your baby? You cannot. If the baby is not breathing, you will not know until somebody tells you. Incidentally, most times, it is other persons that will tell mother, your baby's neck is this way and that way. But we're saying that if the baby is put on your chest, between your breasts, you are able to see the baby. The baby locks her eyes onto yours and can breastfeed as and when due, because you can just shift the baby and the baby breastfeed. We're saying that the baby will be unclothed, but will have a cap on his head, socks on his feet, and of course pampers or whatever you use to prevent excrement from reaching your body. We keep the baby there almost all the time, except if the mother needs to use the bathroom. We're asking fathers that they can also do kangaroo father care. The fathers can put their babies to help the mothers, because the mother cannot be there 24 hours sitting there with the baby there. The father can help. The grandmothers can also help. Please let us adopt kangaroo mother care. The Nigerian government has adopted it. What we're saying is that when you see mothers with their babies in front, it's okay when you see the white people with their babies in front. We don't see anything, but anytime a Nigerian mother puts her baby on her chest, we complain. It is the best thing to do. It is the right thing to keep the baby surviving. The baby will survive and will thrive. The issue is that if a baby survives and is surviving with a disability, that is not the kind of baby we want. We want a baby that will survive, that will develop normally. Indeed, science has shown that babies that are put on kangaroo position develop even better than babies in the incubator. What we need the incubator for is for babies who are unable to breathe. So for the period where they are unable to breathe, they can be in the incubator. But as soon as their breathing is normal, please let's take the baby out and put the baby to the chest of the mother where they can thrive appropriately. I don't know if I've covered.
Yes, I think you've covered most. Yes, Nigeria as a country has adopted the kangaroo mother care, and basically is based on the issues she raised. The other thing is you find that taking care of that baby in that position is much easier in handling every aspect. But fundamentally, is the front of the mother is warmer than her back and is more protective. So we encourage mothers to practice the kangaroo mother care. Thank you.
My experience, no, my own, up till now, I'm still going through some problems, but I know that one day I will get out of it. And since I delivered these children, I gave birth to them at 6 months, 2 weeks. Actually, from what doctor said, I had the experience also, which I can pass out to others out there. But what actually happened to me, I had malaria, and the medicine was given to me. And once I took the medicine, then I started seeing water. From there, labor, I fell into labor and I delivered these children. So, from my own experience, I can tell others to go to a good hospital where you can be checked before giving